Hello to all the viewers. It's a proud feeling for me to introduce to you Dr. Sidharth S, who has secured rank 3 in the AIIMS merit list and rank 6 in the common merit list of AIIMS DM Neurology entrance exam. Sidharth, happy, proud feeling?
Sir, more than happy, I'm relieved, sir.
Yeah. So it's a big achievement on a national level. So to begin with, let's take through that moment when you saw that rank on the list. So just take us through that moment when you saw your rank.
Sir, actually, I was in the Manali trip. I had went with my friends for the trip post my MD exams. So I was on a trek that day. So continuously every 1 hour I was just refreshing the website. And suddenly in the evening around 8:30 it came. And sir, actually at that time my net was not working. So I had to download it on my iPad through the Wi-Fi. And sir, there was no search option at that time for roll number. So I had to just see individual ranks, and luckily, sir, at number 3 only I got my roll number. So I was really relieved and thankful that I got into AIIMS list.
Okay. Now the viewers should know that Dr. Sidharth is a real champion, and I say that because he has secured this rank along with his final MD exams. In fact, to the best of my knowledge, he wrote the AIIMS exam in between his the final MD exams, right, Sidharth?
Yes, sir. In between two papers.
Yeah. So Sidharth, take us through that last month, MD exams, preparation for theory, practical, INI. So what was going through your mind in that last month?
Sir, last month, sir, actually the date sheet was not announced for the MD exams for my university. So I thought I will study for 1 week or 10 days completely oriented to neurology. So then the date was announced as 23rd April in between my 2 theory exams. So sir, then I had to shift my mode to preparation of my MD exams. So sir, it was going neck to neck, like neurology I completed 10 days, then it was completely a MD exam preparation. And in between I used to see half an hour or something, some topics just to refresh the notes and just to refresh the idea of the neurology. And sir, it was a roller coaster ride for me with MD and INI. And I really feel relieved, sir, that it has ended well.
Okay. Now, Sidharth, I still remember, you had sent me a message in February.
Yes.
So you were actually planning for the November INI in your mind. So can you just go through that message, what you had sent me, and from there, how did your preparations change?
Sir, in the month of February, I was not, I thought that I'm not well prepared enough for giving the April exam. Although I had read the neurology word by word from Harrison and your notes, but still I thought it's a national level exam. You have to be completely perfect enough, because in middle of the MD, I did not think that it could be possible. So I had messaged you to appear for the November exam. So how to approach for that? And you specifically told, sir, the first attempt is always the best. And with the MD exams, if you give the exam, so you are fresh enough, you know the other things, you rule out options, and that is always the best possible way. So then, sir, I thought I should approach for the April INI exam, and I was specifically focused for AIIMS only, sir. So then I thought to complete the neurology and side by side my MD exams. So the both helped to clear the exam.
And you were very focused on INI, because the message that you sent me reads like this: I am planning only for INISS. It's not like I'm preparing for INISS. I am planning only for INISS. So you were very determined, right, Sidharth?
Yes, sir. Actually, AIIMS Delhi was always my option, and I had narrowly missed in my MBBS and MD days. So this time I was very determined that if I will do a DM, and it will be in AIIMS New Delhi only. Otherwise, sir, I had given my MRCP part 1 and part 2 in my PG days. So I was planning to go to UK to do my neurology. But sir, one option I still, the AIIMS, the AIIMS craze still has in my mind. So one option I kept, that I will give just one attempt for AIIMS Delhi. And if it does not happen, then I will think of going outside India.
Okay. So just take us through your journey with DocTutorials. So how useful were the lectures? Because I suppose you have gone through everything, the lectures, the Q bank, the
Yes,
exam.
sir.
So how did the content in DocTutorials help you, and was that sufficient for preparing for the INISS exam?
Sir, first of all, the DocTutorials, when it was launched, I was lucky enough that there was some test where they gave 1 year subscription free to top two rankers. So I was one among them, and it was 1 year subscription. So, sir, I had prepared that I will do neurology. I had developed interest in neurology at the end of first year of residency. So, sir, I knew you since my post MBBS days that earlier you used to teach rheumatology and all. So I thought I would watch your lectures, and because it were very knowledge based lecture and motivating, so I swiped the lecture of neurology and I started watching the videos. Sir, it was not a whole approach like I will complete all the neurology in 1 month or something. It was a scattered approach because at that time I was still giving my MRCP exams in between. So since the interest of neurology was there, so I started watching your lectures, starting from the headache and then the epilepsy part. And then, sir, due to the COVID second wave, there was a gap of 2 to 3 months. And then I rewatched it again to dementia, movement disorders, and I completed all your videos in the month of January 2022. So I still remember the last module. I think I watched the treatment of the stroke. So I had watched the strokes in different parts. So the treatment of stroke was the last module I watched, and it got completed in Jan 2022. And I had already made the notes and I had revised the notes. And sir, since February, it was like a rapid fire. I just brushed the notes once again, and in the last minute, it just I went to the slog overs and I just pulled it.
And what about the INISS questions? Whatever you have listened in DocTutorials video, the question bank, the test series, did everything help you for the pattern of INI?
Sir, it was, I think, the best gift that any neurology aspirant can get. The neurology that you have taught us, it is so extensive yet so concise, I would say, because it has covered. If you see even word by word, you say you have to read Harrison. Sir, I would say apart from Harrison, the aspirants can read word by word of your notes because every word comes as an MCQ. And sir, the considering the competition and the pattern these days, you never know where the MCQ is taken and where the word comes. So you can't miss out on those. And sir, your notes and your videos were really helpful. And they had Bradley tables also. And you had shown us the Bradley tables like facial nerve involvement seen with these disorders. And that came as an MCQ direct. So, sir, it was like for a student like me who is doing MD in a MD in Delhi, and also active duties were there. And apart from that, we have to study for the MD exams as well. Then thesis also was completed in third year only. So, sir, your videos gained insight into Bradley, and it is a very good source to prepare. And it is, I always believe, sir, it is not about studying Bradley and just saying that I have studied Bradley. It is about knowing those concepts, knowing those knowledgeable items that is present in the book. So you can gather that either from studying directly from Bradley or you can study from the videos. So I think your videos provided a great insight into the neurology and also Bradley.
And how did you manage the elite exams that we had conducted? Because I know that since you were doing your residency, attending every exam was not possible. But going back to those elite exams and going through the questions, because I had conducted specific topic-wise exams like dementia, epilepsy, headache. So how did those questions help you?
Sir, I went through all these questions. I think it was the Elite series of last year, 2021, and it had every topics of 30 MCQs. So I had gone rapidly through all those MCQs last month only, in the month of, I think, end of March or something. And it really gave an insight into all the topics in one go, because sir, revision is the most important key in cracking any entrance exam. So if you have studied dementia one time, two times, then if you solve the MCQ, then you come to know that these are the weak points that you have, and these are the that you lack some way or other in this topic or in this subtopics. So then you can go back and revise your notes again of only those portion rather than revising all over again. You can just go back and revisit only those topics which you are weak. So those MCQs were, sir, like only I thought that I was attempting an AIIMS paper only, because the quality of MCQ were really good, and it had balanced MCQs of all the trials, all the genes, the MRI images, clinical scenarios. So I think, sir, I enjoyed solving that MCQs even more. So I think it really helped.
Say that word enjoy. I was talking to your own batchmate Farsana. So both of you actually did MD together. In my conversation with her also, she's told the same, that she enjoyed learning neurology. So this is a very important message that all aspirants should know. Rather than focusing too much on the result of the exam, it's about enjoying the subject. And eventually both of you, Farsana and yourself, you have done your MD together in Lady Harding, and both of you have got selection to AIIMS as well, because both of you have got top ranks. So how important, Sidharth, is this enjoying the topic that you really like?
Sir, I think it is the most important thing that you can't target an exam, you can't target an MCQ or any other exam for per se. If you have the interest in that topic or subject, then you can go on studying without thinking about the result. Because at the end of the day, sir, it is not about the result; is just a one day thing. But the process of getting that result, that is more important, and you have to enjoy that process more. And by doing this, you get good output, sir.
And see, your common merit list rank is 6. And in
Yes,
the
sir.
interview round, you have improved so that your rank has become 3, 6 to 3 in the AIIMS merit list. So for the interview, after the initial results were announced, we had conducted the mock interview sessions. So how useful were those mock interview sessions in shaping up for the interview?
Sir, I think when I gave the exam of theory, sir, I still remember. I just want to tell that there were 2 questions which I marked it correctly, but when I revisited it, I somehow had changed, because sir, your mind just messes up sometimes. So I was very apprehensive that I may miss the seat by just that 2 questions, because in this level of competition, 0.33 marks even matters, and so I was very apprehensive, sir. So after the stage 1, the the marks were not out. It was just that the candidates have qualified. So still I was sure that my marks would have been in the top 10 or something. So I thought I would give my best shot for the interview. And sir, luckily, interview also you had played a great role, because you formed a group and you had given all the previous interview questions and all, and you had conducted a mock interview where you used to ask individual candidates the questions, just like happens in the real interview. So it was really a changing moment where we got the practice of the interview and how to answer and how to describe the images. And sir, this time the interview format, they had given one question to the candidate. So sir, previously, as told by you, that there were approximately 2 or 3 questions asked to the candidate. So even if the candidate does not know one question, and if he answers other 2 very well, so he gets selected or gets good marks. But sir, this time it was one question. So if you know that, if you don't know that question, then it becomes very difficult for you to come back. So luckily, sir, I got the image of CT brain, and just like you had taught us how to describe a lesion, like if it is a hyperdense lesion with surrounding hypodensity, with midline shift or not, or any pressure effect, mass effect, and everything that you had given the sequence. I still remember that I was given the MRI sequence of Creutzfeldt-Jakob disease by you in the mock interview, and I had described it in the way that you had taught us. So in the CT also, sir, I had described the lesion clearly in the way that you had taught all of us. And then the examiner asked me, what will you think? What is your diagnosis? Then I told that it is an intracranial bleed. Then he asked where is the lesion. So sir, it was in the lesion of the basal ganglia and internal capsule. So then there was discussion of the basal ganglia. Then what is the clinical deficit? How will you treat? So sir, it was a really good experience for me in the interview. And I
Very, very
luckily,
important. This is very important because many a times candidates, when they see a CT or an MRI in the interview, they just jump to a diagnosis.
yes sir.
Remember, their intent while asking you such a CT or an MRI is not to get a spot diagnosis. So they want you to describe. So that is how they assess, right? That is what you also felt, Siddharth?
Definitely, sir. And I don't think, sir, if it was not told by you before the interview, then I think all the candidates would have directly jumped to the diagnosis like it is IC bleed. Because in the wards and all, sir, emergency, we just see the image and we see that it's a IC bleed or infarct or like that. We used to say as a medicine resident. So, sir, it was a really good practice given by you. I'm very astonished that you had given us 2 hours every day of your hectic time to conduct this mock interview, and it was really a commendable job done by you. And I can't thank you enough, sir.
It was a happy moment for me also because majority of the candidates who went on to have the actual interview, they were in the group. So you all could see how the others are actually answering. So Siddharth
Yes,
would have a view, okay, this is the level of competition that I have. So this is how I have got to answer. And the mock questions that I have shared with you just gives you an indication, okay, this is probably what I can expect. So even if you're not getting exactly the same question, you know how you have got to answer, how you have got to approach. Because interview is entirely a different approach. It's not say an MCQ model or testing your theory knowledge. They are testing either your say approach to a clinical scenario or approach to a radiological image. So they are assessing. Okay, so that is very, very important.
Sir,
So
I think
Siddharth,
sir, interview is one thing that matters a lot, sir. Initially, before giving the exam, I thought that theory is the only one. Like if you score maximum in theory, you get through. Then when I saw the result of the last year, December and all, and then I came to know that interview plays a very important part in deciding your rank because there is very narrow margin for AIIMS, sir. Theory, you can get a seat in CML, like you got PGI, NIMHANS and all other institute, but AIIMS, you have to be specific in your interview. So I think the 2 marks that I lost in my theory, I covered it very well in my interview, and I got 18 by 20, sir. So that is a very good rewarding marks.
So anyway, I'm very happy for you, Siddharth, because I could sense in the message that you send me after the results, it's the result of constant hard work, so much of persistence, and you had a definite ambition, because I'll always tell the candidates, even to end this interview also, he said a line, I just want AIIMS. So that is how, you are focused on your dream. He was not saying even he had a NEET SS exam to prepare because the exam is going to happen next month, but it's not. It's even if he does not get this INI, he's going to prepare for the December INI. So hats off to you for your dedication, and the result is the end product of your constant persistence and hard work. So
sir, I'm very fortunate, sir. Like I have cleared all my MBBS, MD, DM in my first attempt.
Great.
And this attempt, sir, I would really thank you for providing the extensive approach of the neurology, and till the last minute, sir, you were with us. So it is a very commendable job, sir, and I would really like to thank and be in touch with you for future also, sir.
Sure. All the best. Thank you lots for joining. Thank you.
Thank you, sir.